Hi everyone, this is Neil Writer, also known as the Wax Whisperer. Thank you for tuning into this latest video. For anyone who doesn't know who I am, I'm a UK-based award-winning consultant audiologist and clinical ear care specialist. As an audiologist, I specialise in the diagnosis, treatment and rehabilitation of people suffering from hearing loss and balance disorders. And as a clinical ear care specialist, I specialise in the removal of impacted earwax, foreign bodies, infected discharge and debris from the ear canal. We have a client who attended this morning. We're just in the left ear here, and you can see that wax is very soft and gooey. She's been using olive oil drops for about 2 or 3 weeks, I believe. So it's very soft. The entrance is quite narrow, a few cilia there. So I've just gone in with the Zollner suction probe, and we've got a big mass of wax there, and it's just come out in a nice big chunk. You can see how oily it is. You can see where the suction probe is. You've got a thick layer of keratin. That's the white glossy substance that's coating actually all around the wax. Actually, you can see it there. Just going in. She has very narrow ear canal entrance. It's a bit blurry there because of all the oil, but the tympanic membrane is visible, and I'm just mopping up at the entrance. So that's the left ear more or less done. The interesting case in this procedure is the client's right ear, and here we are. So she had been using cotton buds. Now, cotton buds, Q-tips, cotton swabs, whatever you want to call them, if you read the fine print on the instructions on the packaging, it explicitly states do not insert in the ear canal or the nostril or nasal cavity. Cotton buds are not designed to go in the ear, contrary to myth and belief. They've got many purposes, but they're not designed to remove wax. They just actually force wax further in the ear, and this is what's happened in this case. The patient has really impacted the wax. So I removed some wax, a big chunk of wax there. You can use cotton buds on the external part of the ear, what we call the pinna, in all the folds and creases. Wax has got this tendency of naturally migrating out of the ear, and it then can go behind the ear itself and into these folds and creases. That's fine. People often say, well, they clean their ears regularly with a cotton bud or swab, and if you've got the cotton bud in your ear and you're swiveling that around the entrance, yes, you may just be wiping some surface earwax off the canal wall, which is actually healthy wax. Wax has got some good health benefits, but otherwise you're just pushing it further in. The ear canal is approximately, on average, about 8 millimeters in diameter. A cotton bud, I would say, it's about 3 or 4 millimeters. It's only going to go one way, and unfortunately this patient has paid the price for using the cotton buds, and it's really impacted deep in her ear. So just put some olive oil ear spray into the ear canal just to soften this, because it really is lodged against the eardrum. She's done a good job at really compressing it and impacting it. It's quite medial there. It's in the outer parts. You can see some dead keratin that's adhered to the ear canal wall and also the earwax. The wax is lodged in a region of the medial. So when I say medial, I mean nearer to the eardrum, in a region called the isthmus, which is a narrowing, quite often seen between half a centimetre and a centimetre away from the eardrum. And you get this narrowing, the bony part of the ear canal, and then the ear canal protrudes outwards again, so it widens. And when you've got a plug of wax or dead skin in this region, it's sometimes quite tricky to remove because we're having to extract this wax, a large piece of wax, through a narrow orifice. And as you should be aware if you've been watching my videos, the inner 2/3 of the ear canal, it's literally a very thin layer of skin, 0.1 millimeters compared to 1 millimeter thickness of skin that coats the outer third of the ear canal. And that thin lining of skin is literally coating bone. It's very sensitive. The outer part of the ear canal, the outer third, is made of cartilage. You've got some fatty tissue there, which acts as a buffer. So whenever you remove wax deep from the ear, you do have to be very careful. You may have seen earlier when I drained the ear, first of all, I did suction some of the oil out because you get a bit of blurriness. So that's important when you use drops. So I did, after instilling the drops for about 5 minutes, I got the client to lay the opposite way. So the ear is facing the ground, and we drained a bit of this oil out with a bit of tissue underneath the ear to collect it. But there was still some residual oil into the ear, so with the Zollner suction probe, I just vacuumed that first so it doesn't blur the tip of the endoscope and obscure my vision. To see, I'm just trying to lift the dead skin and wax off the canal wall, but we're just going to be really careful. You can see the isthmus there, you can see where the wax is, and there's on the suction probe. You can see the ear canal wall, and you can see it kind of almost goes up and over, and this wax is lodged beyond that visible part of the ear canal where the ear canal widens. So again, just going to be really careful, just peeling off this keratin that's adhered to the canal wall, and also the wax, just going superiorly there. So despite the olive oil, it's still quite impacted, still quite tough to remove. You know this has been in the ear for a long time. If you look at the colour of the earwax, it's quite dark, so it's oxidised. Just got a bit of a suction grip here, just going round in circles. Just imagine this is in your ear against your eardrum. You want your specialist to be very cautious and very delicate. As I said, the patient is awake, no general anaesthesia or local anaesthetic, and we're right up against the eardrum here, so everything we do is very delicate with a soft and deft hand. So I'm just trying to peel some more skin. Once you peel the skin, it's like double-sided tape. It sticks to the canal wall and also the wax. And if you can peel some of this, it just makes extraction of the wax a bit easier. But it's still quite dry. You can just tell by the consistency, the texture. And you've got to be careful when you're working this deep, when you're putting the Zollner suction probe against the wax. You want to avoid any additional pressure, because you'll just be pushing this wax right up against the eardrum, and it can be very uncomfortable. So whenever we work this close, you're literally just kissing the surface of the wax, almost hovering over to get a suction grip. And if the wax is very hard and dry, it's hard to get that suction grip. So that's why olive oil drops sometimes does help when we work really close and deep in the ear, because that softness, you get a bit of traction with the vacuum and it grips a bit better. Again, I'm just really wriggling it. There's no other instrument really I can use. An ear hook, well, the wax is completely including the ear canal, so there's very little space for me to insert the ear hook in between the wax and the canal wall. If I did, it would be very uncomfortable. Forceps, possibly, now that I've extracted some of this lateral part of the wax, there's something to grip onto, but again, suction's fine. We're making good progress now, so a big chunk of dry wax removed there. Okay, it's just a bit blurry, so I've just wiped the tip of the endoscope. There we are, got a slightly better view. The patient is of Asian descent, and there's a reason why I'm saying that. I'm also Asian, by the way. It's when you visualize the ear of an Asian or Afro-Caribbean patients, it's not as always vivid and bright, the colour, and that's because the skin obviously is a bit darker and shaded within the ear canal, so you don't get that kind of same reflection. So that's why the colour's a bit dimmer. The settings of the endoscope are exactly the same, but again, I can see exactly what I'm doing, and I'm just manipulating this wax forwards. The oil's helping it. I always compare the olive oil to some soap. If you've got a ring stuck on your finger and you put some soap there, it just helps lubricate the finger and the ring, so you can remove the ring from the finger if it's got stuck. You can see all that dead keratin. That was using the Zollner suction probe, the standard 2mm tip, and I've just attached a fine end now, so some debris anteriorly and superiorly. So this superior anterior quadrant, so the northeast part of the eardrum. Eardrum is visible. It's a bit dull because I'm using a lot of drops. It's the glossiness is not quite there. This is the haul of wax. That's not all the wax. Obviously, some of the wax got suctioned up the liner and the suction probe. So that was 363 milligrams of earwax, which equates to 0.363. I'm hopefully going to keep a little leaderboard here. I hope you enjoyed that video, guys. Stay tuned, and I'll upload some more during the week, hopefully. Take care. Bye.